Heart disease is the #1 killer of women in the United States. While more and more patients are waking up to that fact, many are still asleep when it comes to awareness of other diseases that can lead to heart disease. In our continuing look at women's health issues, Lorene Cachola shows us how a little knowledge can go a long way toward prevention.
I was doing the charity walk, and I had walked it year after year that particular year. I don't know what it was, but I was whining the whole time about my darn leg. It's killing me. I just couldn't make it, and it was just all I could do to walk.
What Patricia Nivens didn't realize at the time was that she was experiencing the first symptoms of peripheral vascular disease, or PVD. The most common type of PVD is peripheral artery disease, or PAD, which is associated with heart attack and stroke.
The physiologic process of arterial disease is actually a plugging the arteries. Just like the pipes in your house would get clogged, the arteries in your body get clogged. And when they get clogged in the heart, most people know that that causes a heart attack and causes chest pain.
However, when this clogging of fatty materials occurs in the leg or peripheral arteries, you might feel pain, but you might not. Or you might think, as many do, that the pain is just a sign of getting older. Patricia wasn't taking any chances. She checked in with Dr. Zini right away and put her legs to the test.
The ABI test, or the ankle brachial index test, is a simple test that can be performed in some doctor's office or at the hospital. And they place blood pressure cuffs on the arms and the legs and measure the blood pressure cuff readings in the arms and legs. And if the blood pressure in the leg is lower than the arm, then there's arterial blockage. And so by screening for arterial disease in the legs, you can detect arterial disease in the heart.
You can also start off on the right foot now with some sensible preventive measures.
The best way to control it is to minimize your risk factors. The #1 risk factor is smoking. Stopping smoking, controlling the diabetes, trying to control their diet, trying to keep their weight down, and exercising.
If the blockage is considerable, your doctor may recommend a surgical procedure.
There are a lot of really good new treatment options for arterial blockage in the leg arteries. Stents, balloons, removal of the plaque.
Patricia's blockage was quite involved. She's had an angiogram, an angioplasty, and a stent inserted to keep the blood flowing. Now, she's following doctor's orders by taking medication and by alternating exercise with rest. Thanks to Dr. Zini, she's starting to feel like her old self once again.
And he's fixed my leg. I can go to the grocery store and go shopping at the mall, and I can do a lot more housework. And when I would go to lunch with the girls I work with, I'd be bringing up the rear, and they'd be way up there, and they'd just wait on me, you know. Now I stay right with them. Makes me feel real good.
For Smart Medicine, I'm Lorene Cachola.